a video of an old video, like from either the 70s or the 80s. It's hard to tell based upon clothing and hairstyles. I think it was probably early to mid 80s. And it was interviewing an elderly individual who had Alzheimer's disease. And he was a twin brother. Anybody watch this video, the full thing? I mean, I showed you a little segment. It'd be helpful, I think, to watch it, just so you can understand how this manifests itself. But we actually talked a little bit about, and we saw a little of the sequence where there was a harmonica and a rhinoceros. You guys remember that? And he was shown a picture of it, and he was asked, "What's the name of it?" And he couldn't quite answer it. But he was being kind of cute about it. He wasn't being rude and obnoxious. He was kind of toying around with the interviewer because he's a pretty bright individual. So most of Alzheimer's patients, they try to hide the fact that they're developing Alzheimer's most of the time because they know it's a debilitating disease and it's really tough on the family. And so they just want to kind of fake it as long as they can. So we're going to talk now on this slide, I don't think we covered this part, about what happens with Alzheimer's and what are the lesions that are in the brain that characterize Alzheimer's disease. So a few facts about Alzheimer's disease, some risk factors that we did mention, but we didn't get to this slide. Age is a huge risk factor. The older the patient, the more susceptible they are to developing Alzheimer's. Individuals that have a history of prior head trauma. And prior head trauma doesn't mean repetitive. It could be just a single time. Females are more susceptible to developing Alzheimer's than men currently. I think those numbers are going to be changing or normalizing out as time moves on. And then I introduced this concept, which is a little controversial, but a low education level or low level of mental exercise is typically associated with an earlier detection of Alzheimer's. So what does that mean? If you're educated and you're intelligent, you're not going to develop Alzheimer's? No, I think if you're educated and intelligent, you might be able to fake it a little bit longer. Okay, you can find other words that substitute for the word that you're having trouble finding. Okay? You might be a little bit more clever. You forgot your address, but you were kind of wise enough to write it down on a slip of paper and put it in your phone case. Because you can never remember how to unlock your phone. You can't remember the password, right? But you know that there's a slip of paper in the back, and maybe that has the password on it. Little things like that where people kind of figure out creatively, how do I adapt to this fact that I'm very, very forgetful? So this dementia, it's the number one type of dementia that our patient populations deal with, but it's by no means the only one. Okay? And there's a mental impairment with a preservation of consciousness. So you have mental impairment, but the patient is still fully conscious. So they become forgetful. They might do things that they don't remember doing, almost in a way like sleepwalking. If anybody's ever sleptwalked or know people that sleepwalk, you might say or do things, but you have no memory of it. Okay? And so there's consciousness happening in these patients, but they have mental impairment. At the root cause is a little bit of a difficult discussion. So the question is, which comes first? Do the plaque lesions show up and then the patient develops Alzheimer's, or do they develop Alzheimer's and that manifests itself in plaque lesions in neural tissue? And we don't know the answer to that, because when you're diagnosing a patient with Alzheimer's, and a couple of you came up afterwards and we had this conversation where, can you truly diagnose a patient with Alzheimer's without actually doing a biopsy sample of the neural tissue? Well, the answer is yes. Patients are being diagnosed with Alzheimer's all the time, and they're not getting a brain biopsy. Now, you may not be able to confirm that there's beta amyloid plaque lesions until there's an autopsy. But some families elect for no autopsy. Say, hey, you know, Grandpa was 82 years old and passed away. We know that he was wrestling with Alzheimer's for the last 3 years. It was really difficult. Why do we need an autopsy? Like, that seems kind of ridiculous. We don't want to do that. Or there's religious reasons or, considerations that the family just doesn't want to do it. So on the death certificate, it likely will still say cause of death, terminal, end-stage Alzheimer's. But there may not be any beta amyloid plaque histology to go along with it. Does that make sense? So we don't really know which comes first, or do all Alzheimer's patients have beta amyloid plaques? Okay, but one thing we do know is if patients are diagnosed with Alzheimer's, you can't do a biopsy tissue and keep the patient alive. It doesn't work that way. Okay? Now, we'll talk about cancer in the next lecture series, and we do a lot of biopsies with cancer. Obviously not brain cancer, but with other types of cancer in the body, we will do biopsies. Okay, so let's talk about this amyloidosis. So the way that this is set up is there are these normal amyloid proteins that exist in neural tissue, in you and I. And as we get older, the conventional thought is, the primary central dogma is, that you get a dissociation. So you've got this amyloid precursor protein. There is a alpha and a beta sequence, a gamma sequence, and then a carboxyl terminal. And it's embedded in a phospholipid bilayer. So this is in the membrane of neural cells in the brain. And they can dissociate, and they can actually swap out normally. They can go from A to B. But unfortunately, in certain patients, they dissociate, and then they actually clump. And so our AB component, this red cylinder component, actually clumps. And we actually have these amyloid-soluble fragments that form these fibrils. And they form these plaque lesions within neural tissue in various locations. And if in their centers in memory, then the patient loses memory. So these amyloid fibrils and these beta aggregates are shown here. So we've got these amyloid fibrils, and we've got our AB aggregates that are forming in the middle and the far right panel. But they create these lesions, and you saw on the video, it showed, maybe a little bit more blurry, but it showed some examples of immunohistochemistry that was kind of like this slide over here in view, right? Where you're getting these pockets of lesions or beta amyloid plaques that are forming, whether it's the amyloid fibrils or the AB aggregates that make up of that plaque. Okay? So that's the disease. Now, my opinion is that this process gets worse and worse as we age, and in most all older patients, there's some amount of beta amyloid plaque formation in their brain. The question is, does it hit certain memory centers and stimulate the disease known as Alzheimer's? If it doesn't, they might expire from cardiovascular disease, but if you did an autopsy, you might find beta amyloid plaques in their brain, and they weren't presenting with dementia. Okay, and there is evidence in the literature of that, where there are post-autopsy reports of patients that actually have amyloid lesions, but they didn't have dementia. They didn't have reports of Alzheimer's. It may be that was coming 5-10 years down the road, but this process of having these plaque lesions or scarring in the brain makes sense when I think about the aging process. Scarring gets worse as we get older, and so why would the brain be any different? Does that make sense? So that's sort of my opinion on it, but this is highly debated on which comes first. Okay, does the disease cause the plaque lesion, or is the plaque lesion causing the disease? So obviously, my bend is I think the plaque lesion's causing the disease. There's a question. You good? Yeah, this naturally will dissociate, but they won't aggregate and clump. That's the disease. We don't. Yeah. Okay, Parkinson's disease. And so we have two more to talk about, Parkinson's and CTE. So Parkinson's disease is a disease of the substantial nigra. This is in the midbrain. It's part of the basal ganglia. And patients that wrestle with Parkinson's disease have a problem associated with dopamine. So you can see in the normal brain slice, this dark pigmented border of the substantial nigra is where we've got a lot of dopaminic activity, or dopamine is being released. Now, dopamine normally stimulates the substantial nigra, and what that does is it minimizes or inhibits unwanted movements. So you can see in a depigmented brain slice within the midbrain, you're not having as much dopamine being released, and so the dopamine doesn't stimulate the substantial nigra, and you get unwanted tremor in these patients. You get kind of the shaking of the head, which is very common, or you'll see it manifest itself very early in patients that actually are tremoring of their hands. Now, be careful, not every tremor is Parkinson's. As we get older, we do have a essential tremor, and it will get more aggravated. It doesn't necessarily mean that it's Parkinson's. If it's affecting the midbrain and the substantial nigra isn't receiving the dopamine, then that's a Parkinson's type of scenario. The most well-characterized Parkinson's patient was Muhammad Ali, and down in Phoenix at the Barrow Neurological Institute, his family has donated a tremendous amount of money to do research on Parkinson's syndrome. Now, more recently, there's been a lot of discussions in the literature, in the media and in the scientific literature. So Muhammad Ali passed away in 2016. And after his death, there was a lot of conversations around, was it truly Parkinson's or was it a different disease, which is called chronic traumatic encephalopathy, or CTE. So CTE is pretty newly described in Western culture, although it's existed for a long period of time. So this is a progressive degenerative disease. It comes from a terminology that is talking about head suffering. Okay, so encephalopathy is suffering of the head. That's what that word actually translates to. And chronic traumatic encephalopathy, or CTE, it's a condition where you have brain damage which persists over many, many years, decades, in fact. So you have patients maybe that have repeat concussions, or they're in activities where they have head trauma on a regular basis. So what are we talking about? Well, we're talking about a disease that formerly was characterized initially in pugilists, or what we call boxing. And so this is, about 100 years old. But it wasn't until more recently that we've seen it, and it's been described within professional football players in the U.S. The brain is atrophying over time in a lot of areas, and there's enlargement in other areas. Okay, and we see this post-mortem. There's a lot of tau protein accumulation over time. This is another type of lesion. Like the beta amyloid plaque, here you have a lesion that's made up of a tau protein, a different type of protein that's normally found in the brain, but it's aggregating and forming a scar, just like what we saw with Alzheimer's. But it's tau protein instead of beta amyloid plaques. The symptoms: memory loss, impulsive or erratic behavior, impaired judgment, very aggressive behavior, depression, balance issues, and dementia. So I'm going to show you a little sequence or a video on a trailer. It's a movie trailer. Hollywood made a movie about this. And it's about this physician named Dr. Bennett Omalu. And he was a Nigerian-American physician. So he's from Nigeria. He's played by Will Smith. He's a forensic pathologist. This is a real guy, that the actor Will Smith is playing. He's a neuropathologist. He was the first to publish physical evidence on autopsy of CTE in football players. Now, how do you think that went over in America? Not good, okay? American football, the NFL, is arguably a religion in this country. It's practiced on Sunday, right? So, and many other days of the week. More people like attend NFL church than they do regular church. So it is like a religion. It wasn't well received and it wasn't well accepted. But he was actually studying some 1920s information from Dr. Harrison Martland, who described the disease in boxers in the 20s, like 1928 when it was first described, is what we call punch-drunk syndrome in boxers. They acted like they were drunk, but they hadn't been drinking, and they weren't fighting. This is after the situation, after their career had ended. So let me just play for you this flick. It's, I think, a great movie for you guys to watch, especially knowing what you know now.
Chokes the brain. You get it, Philip. Does not want to talk to you. You turned on the lights and gave their biggest boogeyman a name.
You're going to war with a corporation that owns a day of the week.
No proof was presented today because there simply isn't any.
They have to listen to us. This is bigger than they are.
What you think they're doing to you now? That's nothing. You have no idea how bad this could get.
They have to keep going.
They want you to say you made it all up.
If they continue to deny my work, men continue to die.
Sometimes in life, you're asked to leave it alone. But sometimes you can't. Who are you?
Tell the truth. Tell the truth.
Okay. So the last slide in this lecture, as a summary of Dr. Bennett Omalu, is you can see advanced CTE on the far right. Okay? And this is obviously a very dramatic picture. But he was the one that was doing autopsies on these football players that was discovering horrifically this type of finding, saying something is really wrong. And he was starting to make some of these correlations. And it's based on a true story. There was actually, unfortunately, football players that took their life. They were in such depression that they didn't know what to do. And so because of this event, it sort of popularized, and it from 2016, from about the mid-2000 teens is when things really started changing. And many of you probably saw this if you were participating in athletics. So the NFL rules have now changed, okay, as far as how you can tackle and headshots, whether you're taking them or receiving them, okay. Even youth sports has changed. You know, for kids' youth soccer, now their ability to head the ball has moved up in age. They're not allowed to do that until they're much older. So a lot of things have changed because of this learning. Okay, so it's a pretty, I've never met the guy. I'd love to meet him, okay? Either Dr. Omalu or Will Smith. But here's a normal brain and CTE, and so you can see that there's dramatic trauma that's taking place and injury that's taking place with these patients over a long period of time. Okay, so that kind of wraps up nervous system disorders for us.